How can you get lower healthcare coverage as a realtor? I'm Holly Jackson with Attorney Leave Team at EXP. We can all agree that the cost of healthcare is absurd. We all want to stay safe and healthy, but for self-employed real estate agents, healthcare is unaffordable. That said, until EXP began offering health insurance. Finally, health insurance for realtors we can actually afford. I had a talk with my real estate coach and EXP sponsor about this very topic and want to invite you to hear how this service has impacted his family. Before that, if you would please take a second, subscribe to our channel, like the video, and hit the bell to be alerted when new videos come out. Can you first speak to how long you have been self-employed and paying out of pocket for health insurance?
Sure thing. Well, I went into being a business owner, entrepreneur back in 2012 and quickly got a nice reality check of what it's like to have insurance outside of a corporate plan. And so that was extensive. And then having, multiple kids and, full family size, it was quite a bit to take on. And so probably about I think I was paying about almost 4 times more than I did in corporate at that time. That was back in 2012.
You were paying 4 times more than working your full 9-to-5 corporate position.
Mm-hmm. Yeah, healthcare is fun.
When you first heard EXP offered health insurance to realtors, was it something you looked into right away?
Actually, I didn't. I had a Blue Cross Blue Shield plan basically the whole time. But then when I got my renewal notice in April of 2020 with what my Blue Cross Shield was going up to, it was going up to about $1,500 a month just for the premium. And then the family deductible was going up to about $19,000.
Wow.
And so I was like, this is absurd. And so then I started really looking just to see what else is out there because I was not excited about paying that. It was more than a mortgage. And here I am, remembered that EXP had offered a plan, and I was like, well, I at least need to check into it. And when I did, I had a hard time believing it at first because it was such a difference in cost versus what I had seen across the industry. So now we're on that plan since May of last year, and I'm basically paying about 1/3 of what I used to for healthcare costs. I'm saving about $22,000 in cost this year. And so our premium is about 1/3 of what it was, and our family deductible is also about 1/3.
Yeah, what does that savings mean for you and your family then to be, 1/3 of what you were before paying?
Oh, I got a raise, a big raise, $22,000 a year. I mean, now I can finally afford buying my daughter her next car, which I just did for her birthday, and it's been good. It's been huge for our family to be able to have that savings.
Wonderful. Do you think that there's also the same benefits for a single individual or small family?
Absolutely. And the reason why I can say that is it's not a one-size-fits-all plan. They really do spend a lot of time customizing the plan that's best for your needs. Obviously somebody in their 20s and 30s probably going to be healthier than somebody in their 60s and 70s potentially. And so they customize it very close to what your medical needs are. That's what I loved about the flexibility with how they could structure what the benefits would be versus the cost. And that's what was exciting for us is when we saw how much we could get covered and what it entailed versus what we were doing previously. But now, I've had agents in my group that they're single, younger, and checked out the plan and they're like, I can't believe how cheap this is. And so what's interesting is when you look at the stats from NAR, they published a study not too long ago that said that anywhere on any given year, between 20 to 33% of real estate agents are uninsured for healthcare. And it's because the costs are so absurd that they're having a hard time covering it. And so now this is affordable, really affordable health insurance, and they're really doing a good job of making sure everyone's covered. So it's pretty cool.
Yeah, you need that peace of mind even if you're a healthy individual. Accidents can happen. Major catastrophic events can happen. That's completely unpredictable.
Oh, you said, I have to touch on this since you said catastrophic events. So this is not your normal healthcare plan. The way they structure this is actually in 2 parts. There's a health insurance component where you have in-network, out-of-network. You can do a copay plan or HSA, or those kinds of things, however you want to structure it. But then they also have a health cost sharing component. which is a totally different the way they structure this, and it's really more geared towards when you have like a major medical event happen, whether if it's a car wreck or if you find out, God forbid, I'm not going to, there's a cancer or something major going on that's going to be super costly, and it's going to be over a period of time. Like if you had let's say you're in a car wreck and you're talking multiple surgeries, if you're in that situation, or a lot of rehab, it's going to be spread out over time. So in traditional healthcare, you're going to pay annual deductible. A lot of plans also have co-insurance you got to tack on top of that after you've met your deductible, and you're still covering more out of pocket than just what the deductible was. And so what they have is they have their traditional healthcare plus the health cost sharing. On the health cost sharing side, they partner with a company called Zion. And Zion essentially has a different multi-tier structure of what you can have, like in terms of a cost outflow. And so I'm on what's called the Zion 1000, which means if I have a major medical event, instead of paying, let's say if it was a 3-year deal, right? And if I was at Blue Cross, I'm paying my personal deductible each year to cover that 3-year span. So with the Blue Cross plan, I'd be spending close to $20,000 in deductible over 3 years. Now with this plan, on the Zion plan, basically since I'm on the Zion 1000, I pay $1,000 up front towards that health issue, and it covers me for the life of that medical event.
Wow. That's
for life.
Yeah. So if you break your leg and have to have a surgery, you're paying $1,000, and that's
it. And I think they have like a Zion 1500, a Zion 2500. Obviously the higher you outgo, the less the cost is for the plan, right? So we just, because it was so cheap for the 1000, it was like done, no brainer. And I even I tested them. I tested Clearwater Benefits on this because I wanted to it was such a cool thing. And I'm like, I'm like, seriously, this is really what our plan is like?
It sounds like a superhero name, and it's,
I know.
The way you're describing it, it's superhero power.
So I got introduced to the CEO of Clearwater Benefits who created all of this, and got to talk to him about and question him all about one-on-one conversation with him. And then he confirmed everything that I'm saying. And then later, I even called back and talked to one of their phone reps and asked all the same questions. And she said exactly the same thing the CEO did. So it's kind of cool to get from the top to the bottom, the same consistent answers. And I asked Doug, who's the CEO, I said, so you mean to tell me that if I have like massive, crazy, over the top, $1.5 million medical problem over so many years, you're telling me that that's going to be covered and there's no cap? And he said, exactly. You pay $1,000.
Yeah.
And here was also another big thing too that I was really surprised about, because let's just kind of walk a scenario. Let's say there's a car wreck, you're unconscious, and ambulance shows up, take you to the closest hospital, and you get treated. You come back to consciousness, and now
Sounds
you're
like bills stacking up.
Right. You don't know if that was an in-network hospital or an out-of-network hospital.
Right.
Should it matter in that moment? Probably not, because we're talking making sure you're taken care of and healthy. So what was interesting is they wanted to do away with it, because if it winds up being an out-of-network hospital, you're going to wind up having out-of-network costs with traditional insurance, and maybe some of it's covered, some of it's not, but you're going to have a much larger bill on an out-of-network situation. So what the Zion company did is they said, look, we don't want anybody to be in that scenario to have to make a decision because of that problem. So what they did is they said every hospital, every doctor's office in the entire country is covered basically from an in-network perspective with the Zion plan.
Mm-hmm.
So you don't wake up and find out, oh, no, transfer me to this hospital because it's in-network. No, yeah, we're not having that conversation.
It doesn't work that way, yeah. Mm-hmm.
Exactly.
Not in a crisis.
And then on the flip side of this too, it's like, let's say going back to the cancer conversation, and you don't want to go to just the hospitals in network, but maybe there's an out-of-network hospital that they're the one you want to be at because they're the best at what they do.
Yeah.
Right? Mm-hmm. But if it's out-of-network, now your costs are, whew. And so the Zion plan, same thing. If you want to get treatment there, you pay the $1,000 up front, and you're going to have full coverage at that hospital, because it's all of hospitals, doctors' offices are considered in network.
So you have a double layer of benefits with health insurance. You've got the regular doctor's visits, checkups, regular medical prescriptions, and then the Zion plan helps cover those unpredictable things. What about also dental and vision? Is that something offered with EXP?
It is. They also have all of those benefits as well. And I know they're recently coming up. The last I heard, they were coming up with some additional supplemental plans, even from like a short-term disability and a long-term disability. So now all of that's in the works too. So they've got all sorts of buffet items to choose from. So far, I'm only taking advantage of just the healthcare part. So because my wife, she has a crazy cost for healthcare, but then the vision and dental were super cheap on her nurse company's plan. So we're doing the dental vision through her plan, and then we're doing all the medical through me. So, but yeah, they offer all of those things, and
yeah,
it's all there for the taking. But now it's finally affordable, so that people can actually enjoy having coverage and peace of mind that they're not going to have any crazy bills if something were to happen and they're gambling, not having insurance.
How does a EXP agent go about enrolling or looking at more information about it?
So what's cool is that in the EXP workplace, they have a separate group dedicated just to Clearwater benefits and the health insurance program. And so there's a whole discussion log that's taking place, all the questions, everything going on. So you can go in there and read up on what people have been doing and reading their testimonials. But then also they have all of the health advisors interact in this group as well. And so I work with Thad Puckett, and anytime I want to talk to Thad, I can text him, call him, set up a time, and he's right there for us to answer any of our questions. And they'll do that. Thad, that's what he did for us, is he sat down and walked us through how the plan worked. Really spent a lot of time trying to find out, everything that was going on in our lives, from a medical issue, from prescriptions to what type of pre-existing conditions do we have, and all kinds of different things going on, so that they could customize the plan for us. And that's what they'll do, is they're not trying to upsell anything or make you to pay any additional dollars that you shouldn't have to, because it's truly going to be based on what your needs are.
Mm-hmm. Really, hearing you and individualizing it.
And they're not compensated for additional, upsells and stuff like that. So it's totally, completely neutral, so that you're getting the right situation for yourself.
Okay. I feel like that answers the questions that I have. That's a great information to have about EXP and the health insurance benefits that are provided by the company. Do you have anything else to add about that?
From the healthcare perspective, or just benefits in general?
I think the healthcare perspective.
Okay. So I can't say it enough how I'm excited about the cost we're saving and the type of coverage we have. I have, 5 kids. The youngest is 13, oldest is 19. They're heavily involved in sports. I can't tell you how many injuries have taken place, from broken bones to sprained ankles to therapy. All these different things. And now it's way more affordable than it was prior. So it's exciting. So hopefully this has been helpful for people to understand that you're not in the situation where it's so overwhelming that you can't afford it. Take the time, call an advisor, and really get down to what your needs are, and just be ready, buckle up to see how cheap it is.
Yeah, wonderful. All right, thank you so much, Chris.
You're welcome.
As you just heard, the statistics for real estate agents without health insurance is really bad. And as EXP has shown time and time again, this is the brokerage that is agent focused. This company is really providing everything a realtor needs to be successful, personally and professionally. I'd be happy to answer any questions you may have about EXP Realty. You can just click on the link in the description to schedule a time for us to talk. Don't forget to subscribe, like, and hit the bell. Here at Turning Leaf Team, we're helping people change homes and change lives.